All right, good evening. And this is chapter 11 and nutrition through infancy, childhood, and adolescence. Going to be a laugh a minute. Let's get going. Let me share my screen. And away we go. So we are going to learn about nutritional needs of infants, components of breast milk, foods and feeding practices for infants, how children's appetites and their nutritional needs are different depending on their stage of growth, why hunger, iron deficiency, lead poisoning, food allergies, hyperactivity, and obesity are often concerns during childhood, how parents and caregivers can foster healthful eating habits and food choices. And then we'll talk about the same things as they relate to adolescence, challenges with meeting the nutritional needs of adolescents because of the exponential growth, lifestyle factors that can prevent childhood obesity and the development of type 2 diabetes and heart disease, because yes, that's happening in kids now, which is astounding. So let's talk about the infant. So early nutrition affects later development. And, I say this all the time, you are what you eat. And even when you're an infant, right, you want to get started, hopefully on a good track. They're really pushing breastfeeding now more than ever. Breast milk and colostrum, which is the precursor to the actual milk, are loaded with mom's antibodies and vitamins and protein. I mean, it's really all a baby needs for about the first 6 months of life, give or take. They start to eat food somewhere between, 5, 6 months, starting with, baby foods or pureed foods, like things like bland cereal, and then moving on to fruits, vegetables, and so on. You always want to make sure that the feeding is done in a nice, nurturing environment. Even if you're bottle feeding, and I bottle fed all 3 of my children, I did not breastfeed. I sacrificed 9 months without cigarettes and coffee. That was enough. So, when you're bottle feeding them, it should be just like when you're breastfeeding them, you should be nurturing and loving. Babies grow at such an incredible rate. It's mind-blowing, right? If you think about it, their metabolic rate is in overdrive. We wish we had the metabolic rate of an infant. When you look at a baby's growth just from birth to 1 year of age, they triple their birth weight. And the changes that happen just in that first year are mind-blowing. They really are. Right around 6 months, it starts to slow down a little bit, but that's when their activity starts to increase. So for the first 6 months, what does a baby do? It eats, it sleeps, it cries, and it poops and pees. And that's about it, And the crying is the only activity really that it has. But then once it starts to crawl, starts to walk, starts to, learn about things in the environment and the world around him or her, the activity increases, and then the energy levels will start to increase and the nutritional needs increase along with it as well. And also, here's a fun fact. A normal heart rate for an adult, a normal, healthy, average adult, is 60 to 100 beats a minute. Anybody know what a normal heart rate is for an infant? Yeah, so 120 to 160. A fetal heart rate can go as high as 180. The smaller the thing is, the faster the heart rate. I can't remember exactly what it is. Somebody, if you want to Google it for me real quick, a hummingbird. What is a heart rate for a hummingbird? Somebody Google that for me real quick, because it was a phenomenally high, no way. If we had a heartbeat of 250 beats a minute, we would be dead. We would be in ventricular fibrillation and we'd be dead. So crazy, right? So the younger the child, the more body weight is composed of water, and we are mostly water, right? Breast milk or formula provides enough water to replace the fluids that babies lose. Babies, the very old and the very young, are easily dehydrated. So, for example, if a child were to get, a stomach bug, right, like the norovirus, it would be quicker for a baby to become dehydrated than for an average adult to be dehydrated, right? Because of the fact that they are more frail, right, as an infant, and they're mostly water composition. They lose fluid more quickly. They usually will need some kind of an electrolyte supplement. They have something called Pedialyte that's out on the shelves, which is fabulous. They even make Pedialyte pops now, like ice pops. And back in the day, we just took Pedialyte and put it in ice cube trays with toothpicks in it, and we made our own ice pops. So I think that that patent should be mine, and I should be making some of the profit. But that's another story for another day. It says here breast milk is more easily digested than formula. All due respect, I would probably disagree a little bit with that, because some people have difficulty breastfeeding. The bottom line is that as long as they're getting a sufficient amount of intake, whether it's breast milk or an appropriate formula, they're going to be well nourished. Breastfed babies eat more frequently, right? Because they don't eat as much. So usually the first like 3 months of life, they're eating about every 2 to 3 hours around the clock. Yeah. And figure two, their stomach. So our stomach is about the size of our fist, right? That's your stomach. Think about a baby with a little itty tiny bitty stomach, right? You can't feed them too much in one sitting because they just can't. So they understand small, frequent meals. It's the key to life. And I say that all the time. And when it comes to lactation or breastfeeding, the more the baby breastfeeds, the more milk the mom will produce, right? So what's in breast milk? I've never tasted it, but I'll take their word for it. Carbohydrates are in breast milk and formula. Oligosaccharides. So these are the immunities, the antibodies, if you will, from mom that baby is getting that helps with baby's immunity until baby starts getting his or her immunizations, right? Alpha-lactalbumin. Albumin is a plasma protein. Lactalbumin is a protein that's only found in breast milk. It's very easily digested, and babies need a lot of protein that first year of life too, because of all that growth. You know, they're just growing in leaps and bounds. There's also fat in breast milk, lipids, fatty acids. There's DHA. That's the fatty acid that we have in our brain, that our brain needs for function. It's in breast milk, and now they're adding it to formulas. I know that Enfamil and Similac, which are the two like biggest brands of baby formula, have DHA in almost all of their products. And there have been some studies, there's no conclusive evidence though, and it does say here more research needed, and that's true. Some studies show that DHA can influence their cognitive abilities. So in other words, how well their intellect functions as it grows. So they, you know, there's some belief that DHA has a positive impact on that. Lots of vitamins in breast milk. The only thing, guess what? Anyone take a stab at what vitamin is not in breast milk? D, vitamin D, right? And remember, with vitamin D, how do we get vitamin D? Sun, right? With our skin, right? Lots of minerals. There's calcium, low sodium. So see, it is kind of like the perfect meal. Iron, zinc. Usually we'll give a baby that's being breastfed fluoride supplements because there's not fluoride in breast milk, right? Let's see, antiviral agents, we talked about this already. Colostrum. So colostrum is what comes from the breast usually the first couple of days after the baby is born, right around the time the baby's born. It's more yellow and like a little thicker, and it's got all the maternal antibodies in it. So even if people choose not to breastfeed, even if they just do it for like a day or so the baby gets some of that colostrum, that's like an added boost for the baby's immune system, right? Protective factors that are in breast milk. I'm not going to go through this whole, list, but, everything that we as people have, as adults have, as far as, immune system and antibodies and different types of enzymes, we have lots of things in our body that protect us against infection. Even things like lysozymes that are in your tears have an antibacterial effect, right? Body's amazing. I can't say that enough. I say it all the time, but it's true. And all those things are in breast milk, right? So that all gets passed on to the baby. But fun fact, during childbirth, whether it's vaginal or cesarean, there's an exchange of blood between baby and mom. There just is. And guess what? Whatever mom's immune to, baby's immune to, but it's passive, naturally acquired immunity. So it's temporary. It's going to wear off in about 3 to 6 months. And again, that's why we start giving the baby his or her own immunizations. So they've developed their own antibodies. right? Makes sense? Okay. Mothers can offer closeness, warmth, and stimulation to the infant during bottle feeding. All babies up until 12 months should have either formula, right? Breast milk, that's it, no cow's milk. They shouldn't start cow's milk until 12 months of age, all right? And the infant formulas, I know recently there was a big recall on Similac. Yeah, I mean, anything can happen, sadly. So I guess that's one more testimony to the La Leche League. Like, you should breastfeed. Look what happened with Similac. Question. Oh, thank God. What? Well, yeah, I mean, yeah, they give samples so these formula companies, the hospitals, right, and the physicians, pediatricians' office have samples galore. And a lot of times they'll load you up on samples. Like, if, you know, here, have some samples, take them home with you. Who knew? I mean, was it salmonella? You know? Oh. You don't remember what it was, huh? Ooh, okay. Curious. Okay. And so the percentage of energy yielding nutrients that are in breast milk and formula and cow's milk, there's a chart here that compares the three of them. And so when you look at, you know, the amount of carbs, it's about the same, right? 39% carbs, breast milk, 42% in formula, 29% in cow's milk. Protein and fat, a little bit different. There's 20% protein in cow's milk versus 6% protein in breast milk. But the baby can't handle that high level of protein until they're about 12 months of age, right? So that makes sense. Let's see. Some infants can't tolerate standard formulas. People that are truly lactose intolerant are lactose intolerant from a young age. And oftentimes you'll see babies get very colicky, which is just another word for a bad form of gas. And sometimes they need soy-based milk formulas, you know, instead of regular milk-based formulas. Let's see. If they're, and formula comes either canned or it comes in powder. And with the powder, they're very specific in the way you dilute it. So you use distilled water. And, you know, for example, with Enfamil powder, 2 scoopfuls makes 2 ounces, you know, or 1 scoopful rather makes 2 ounces. And you're not supposed to pack the scoop. It should just be like a scoop and distilled water. If you over dilute it, sometimes, I mean, I worked in the ER, so I would even see this back in the day. I'm trying to stretch my dollar a little bit, and formula is expensive. It's expensive. They would sometimes over dilute it, like instead of using that 1 scoop for 2 ounces, push it to make 3 ounces. But that's a problem because now the baby's getting mostly water and not the nutritional value. Does that make sense? Never put a baby to bed with a bottle. Never put a baby to bed with a bottle. There is a picture here of tooth decay in an infant, just rotted teeth. You know, just imagine if you went to bed with a bottle of Pepsi and it just sat there in your mouth all night. Right? Definitely not good. I mean, yeah, that's an issue too. It's amazing that, you know, I've seen people, like, they'll take a blanket and roll it up and they'll prop the bottle like this. So the baby's got the blanket here and the bottle here. And it's like, you know, can you take 10 minutes and feed your baby? Feed your baby. You want me to feed your baby? I don't know. I don't know. Can't say anything about some people. Yeah. Transition to cow's milk. So again, like I said, not in the first year. After the first year, they start to transition to cow's milk. It says here, after age 2, you can put them on fat-free milk. Again, you know, there are different frames of thought. The American Association of Pediatrics gives, you know, clinical practice guidelines, what you should do. Whole milk for the first year. Yeah, I mean, definitely, because the baby's growing still, or for the second year rather, because the baby's still growing exponentially. But because there's so many children now that are obese, there are so many cases of type 2 diabetes in children, which was previously unheard of. You never saw a kid with type 2 diabetes. If a child was diabetic, it was type 1, which used to be called juvenile diabetes. That's the one that you're born with, But these children are, too much screen time. Nobody's out playing, running around. They're sitting, and they're eating a lot of bad stuff too. Obesity, which leads to type 2 diabetes. So, they're making recommendations now to switch after the age of 2 from whole milk to either fat-free or at least low-fat milk, because they're anticipating your kid is going to be sitting a lot, which if you have children, please let your kids go outside and play and run. They need to move. Introducing first foods. So again, first 6 months of life, the recommendation is just breast milk or formula, right? Developmentally ready for foods between 4 and 6 months. I mean, usually the first food you give an infant is rice cereal. That is the most bland, and when you introduce foods to an infant, you introduce them one at a time. So like when you start the rice cereal, you start it and they just have that rice cereal for a week to make sure that there's not an allergic reaction, right? So then if you move on to let's say you start them on some fruit, you give them peaches. You want to be able to identify what's the problem if there's a reaction. So if you start them on more than one thing at a time, you're not going to be able to say what thing caused the reaction. So you've given them 3 different fruits and now they have a rash. Well, which fruit did it? Don't know. So it's important to start things one at a time in an infant. 4 to 6 months, the babies need additional iron fortified cereals, and those baby cereals, baby oatmeal, baby rice cereal are all fortified with iron. For zinc, meat, poultry, and eggs, right? Those are great ways for the baby to get zinc. And then of course, vitamin C enhances iron absorption. And usually you can get that in the baby in the form of fruits, because oftentimes orange juice and the juices are too acidic for babies. That's actually, they can get a rash and that kind of thing. So fruits are usually the best source. Once the baby can sit up and like handle finger foods, usually that's about 8 months, 7 months, 8 months, give or take. And you start introducing more foods to them, that are more solid. You start off with the pureed foods. Everybody's seen the Gerber, in the jar, looks like mush. And then you can start working your way out of that and into foods that actually have more consistency to them. There's a chart here, which is really helpful for anybody that's going into nursing, that goes through the developmental milestones for infants. So for example, when a baby's born, there are several reflexes that it has. They're kind of fun. Anybody know what the Moreau reflex is? So if you take a newborn and you're holding the newborn and you're putting the baby down like this, it will go like this. It's hysterical. It's hysterical. I'm sorry. That is the funniest thing ever. I would do that just to see them go. It's called the Moreau startle reflex. And that is if that's there, that's normal. And it should be there until about 4 to 6 months of age. Then there's something called the Babinski reflex, where make believe this is the baby's foot, the sole of the baby's foot. You take either a pen or even your finger and start at the heel and go the medial side up towards the baby's big toe. And when you get up here, the toes will open up, they'll fan out and back. That's the Babinski reflex. And that's there until about 6 months, or when they start crawling or walking, that it goes away. If an adult has that, bad. Adults should never have a Babinski reflex. Okay. See, and you thought this was just nutrition. All kinds of fun information. And then this chart gives you different milestones, like between 0 and 4 months, the baby will turn his or her head towards different things. There's something called the rooting reflex. If you touch the baby's cheek, if you touch the right cheek, the baby will turn to the right, looking for a nipple. Touch the left cheek, the baby will turn to the left. Let's see. The reflex, let's see, the ability to swallow non-liquid food. So 4 to 6 months, they're able to start swallowing non-liquid food. They can usually sit without support at about 6 months, and every baby's different. These are just like general guidelines, but they should be somewhere within the parameters of 4 to 6 months. If it's very delayed, then, you want to maybe talk to the pediatrician because there could be a problem. Around 4 to 6 months, they can start putting things in their mouth, which is fun. That's the best time. They wind up with impetigo when they're in preschool. Anybody know what that is? Hand, foot, and mouth disease. So they're like blisters that they'll get in their mouth. And it's just from, they touch things and then they right to the mouth. I know, right? They could start drinking from a cup, like a little sippy cup, when they're about 6 to 8 months old. 8 to 10 months, they should be able to hold their own bottle at this point, they should be able to sit unsupported. And when it comes to walking, there's such a variety. Some babies walk super early, some babies walk a little bit later, but usually by the time they're 18 months old, they should be walking, right? I mean, my granddaughter's 12 months old, she's walking. Some babies, 12, 13, 14 months walking. 18 months is on the late side, but it's still within the window because we're all so different. So you look at the parents and, look at what they're like, and that will give you a good idea. I don't know what you're laughing at. Yes, I do. I absolutely do. And I'm laughing with you, Kim. And so it does give you some idea. Same thing with the size of the baby. If you're 4'10", you're not going to have probably a 10-pound baby. You know what I'm saying? Right? If you're 6'4", you might have a larger baby. So, the size of the baby and the actions of the baby, a lot of that is genetic, mom and dad. Let's see, I already talked about this. Don't give babies sweets. Gotta love this. Back in the day, does anybody know what Caro syrup is? Anybody ever heard of Caro syrup? No? Yeah, one person. So Caro syrup, it's basically like corn syrup, right? It's just straight up like liquid sugar, right, in a bottle. And they used to think, now I'm going back to when my children were babies, the pediatrician would say, take a little Caro syrup and put it in a bottle of water and get them to drink some water, when they're like 4, 5, 6 months old. Well, you don't need to do that. See, we learned so much over the years, but that was actually a bad thing to do because that can lead to obesity. You're already giving them a taste for sweets. Think about it, right? And you don't want to get that started any sooner than you have to, right? And honey should never be given to infants, right? They say under 1, I say under 2. And the reason is the risk of botulism, right? An infant's stomach doesn't have the same kind of acid that ours does and the extent of hydrochloric acid that adults do. And so there's a high risk of botulism, which is a neurological disorder that stems from the botulinum toxin, which is a bacterium. Yeah, a lot of people don't know that. No honey for babies, no honey. And then don't give them things that can get stuck in their airway. Things like grapes. Grapes are not a great treat for, toddlers because they can, next thing you know, you're doing the Heimlich on the baby, right? So you want to give them things that are not choking hazards, or something that when they do put it in their mouth, it's going to dissolve, Let's see, once they get it to be about 12 months old, 2 to 3 cups of milk a day, give or take. Other foods, they should be eating a variety of foods, just like you should be eating a variety of foods, fruits and vegetables and meats and the whole 9 yards. They should be drinking from a cup, not a bottle, once they're a little bit past 1. You should sit down and eat a meal. One of the things that I found, people tend to eat while they're doing things, and it even says here, encourage good eating habits from the time that they're young. The one thing that I always did, I made the kids sit down and we ate dinner. We sat down and we ate dinner, We also had the dictionary on the table because there wasn't Google back then. And we would do a word of the day and we talk about stuff. Like it was fun, You never force a kid to finish food. A child will not starve himself or herself to death, contrary to what you think, right? My oldest son, who is 6'4", he's a beast. When he was a baby, he only wanted macaroni and cheese. When I say baby, he was like, toddler, like 2. Mac and cheese, mac and cheese, mac and cheese. Well, you can't have that all the time. And I was sure the kid was going to starve himself to death, And the pediatrician was like, he's not. And look at him, he didn't, But you worry about that. Like finish all your food, you got to eat. Yeah, they go through phases. And as long as it's only temporary, it's not that big a deal. But when you force them, like you have to clean your plate, you can't leave the table. If they're full, right, that starts a very bad habit. And you can stretch your stomach out so that you need more to become satisfied. So you don't want to start that in an early age either. Encourage physical activity. I said that already. Everybody should be moving. Don't use food as a reward or as a comfort. I have a friend, when she's sad, ice cream, here we come. You know, it's a comfort. And you don't deny food as a punishment. No dinner for you. That's an old school thing too. You're going to bed without supper. Ridiculous. Let the child enjoy their food. Don't force food. Limit sweets. Like I said, they're going to have different kinds of experimental, you know, they may want to try things. They might just look at it and go, ew, I don't want that, you know. So kind of don't force it. You know, once they get older, they'll start to develop more of a broad range of tastes, you know. When kids are, after they turn 1, their appetite, they don't need as much food as they did with the first year of life because of that growth spurt that they were going through, you know. So they're not going to eat as much. So you don't need to be worried about it, really. And even when they teeth, my granddaughter is 13 months old. She's teething. She's cranky as can be, right? Miserable. It's a sin. And doesn't really want to eat as long as they're drinking, right? You can go for a while without food. You cannot go without fluid, right? We worry about kidney failure. So as long as they're drinking and, you know, give them Pedialyte and those kinds of things, so they're getting electrolytes and fluids, they're not going to starve themselves to death. Okay. At about 1 year of age, kid needs about 800 calories a day, give or take. When they're 6 years old, they need, if they're really active, about twice that, so 1600. When they're 10, they need about 2000. You can't put a child on a diet and restrict calories. What you do is you increase their activity and make sure the calories they're taking in are good calories from good foods, right? Not, you know, Hershey's and Snickers bars and that kind of stuff. Even if a kid eats less, if they're inactive, they're going to gain weight. There has to be some time for them to run and play, you know. Very important. Important in development of muscle and bone too. You know, so there are lots of other reasons why physical activity is important. Carbs, recommendations for kids after 1 year, it's about the same as adults. Fiber, they don't need as much, you know, especially if they're moving around. And fat, 30 to 40% of their diet should be fat from ages 1 to 3. And then it drops to 25 to 35% once they hit 4 years old till about 18. Give or take, because technically speaking, you're still growing, right? Believe it or not, and your brain is still developing up through 18, and some schools of thought even say 21, 22. You're not done cooking yet, all right? The need for protein will increase a little bit as kids get older, and vitamins and minerals increase, the need for those. Make sure they get some sunlight so they get appropriate vitamin D, right? They should be getting foods from every food group. I think that that's repetitious. We said that already, didn't we? Appropriate eating habits, stay away from soda. Children need direction in selecting appropriate foods. Make sure you point them in the right direction. Sad fact, there's about 16 million, I think the number's higher than this, children in this country that are malnourished, that are, you know, food deprived, don't have enough to eat. And when you're hungry, can you pay attention? No, you can't do jack when you're hungry, you know? And also it affects the development cognitively of their brain. You know, kids need to eat, and they need to eat breakfast. That's another thing. A lot of schools now are doing breakfast. You know, the kid can come in early and they'll give them breakfast. They have to eat something in the morning. They've gone a whole night without eating anything. That's where the word breakfast comes from, break fast, right? You've been fasting all night, got to eat. You can't make up for that later, just like lost sleep. Oh, I'll sleep in the weekend. You're not making up for the lost sleep. You know, you can't make up for lost nutrition either, right? Iron deficiency is really bad because that, as a child, if they have an iron deficiency, not only does it make them anemic, but it also has problems. It can affect their cognition, because if you don't have enough protein and iron, your hemoglobin count will be low, which means there's not as much oxygen circulating through your body to your brain and your organs, right? So that's a problem. Just a well-rounded diet. The same kind of advice that I tell all of you is what you should be eating. Kids should be kind of eating the same, just a little bit more, right? Especially if they're active. Lead poisoning. You don't see that much anymore, thankfully. Paint doesn't have lead in it the way it did back in the day. Back in the day, they would put lead in paint because it was flame retardant, So, and I mean, some kids, if the paint's chipping off the wall, have little kids, and they would put it in their mouths, and it doesn't take a whole lot of lead to really mess up your brain function. And that's the problem with lead poisoning. Severe exposure can cause irreversible damage, paralysis. It can even kill a kid. So it's really serious. Food allergies. It says here allergies affect approximately 4 to 8% of all children. That's a lot, right? When I was a kid, nobody had a peanut allergy, right? So I'm going back a long time ago, right? You didn't see people that had celiac disease or lactose intolerance. Now, it seems like there are lots of those things that go on. Not so much in other countries.
Yeah, because I'm wondering, is it that people didn't know back then that this was allergy, or is it like a new age disease?
It's more of a new age disease. They've done a lot of studies on that because, when you go to third world countries, you will never, ever find allergic to a peanut. I'm hungry. I'll eat whatever you have, right? I know my friend across the street is from Ghana. It's like peanut allergy. She can't eat. It doesn't even compute when you tell her about it,
Milk too.
Yeah.
Never hear, in what case somebody would say, oh, I drank milk and I have a stomach ache. Everybody would think, okay, maybe you left the milk exposed, or
you drank it too fast, got a little diarrhea from it. Yeah.
But not that.
Not the lactose intolerance, right? And celiac disease, which is an intolerance for gluten. We're even doing it to our pets. I think I told you guys this before, the grain-free dog food. Nobody seems to know where this started, but dogs are dying from dilated cardiomyopathy. The dogs need grain. So I don't know where people got it, and the vets don't even know, where people got it in their head that grain was somehow bad for dogs. And same thing with people. You need a variety of foods. You need a little bit of everything. The allergies that are so prominent now, CHOP, as a matter of fact, speaking of Children's Hospital, has been with great success doing a desensitization program for kids with severe food allergies, specifically the nut allergies. And what they're doing is they're bringing the child in a controlled environment. And every week, just injecting them with a teeny tiny little bit of peanut, right? And yeah, it's desensitization, okay? And just off topic, I mean, when I was a kid, I was allergic to cats and dogs. If I would go into a house where there were animals, I remember being, 6, 7 years old, and my eyes would start to itch, right? So when I got my first cat, what I did was every night I rubbed my face on him. He was a kitten, right? Rub my face on him until my eyes start, and then I take Benadryl and go to sleep. And in 3 weeks, no more allergies. Truly. And I'm not recommending that I'm not giving advice. I'm simply telling you an anecdotal story about my own personal experience, right? But so CHOP is basing it on that. So if you expose yourself to the thing, because what is an allergy? How do you define an allergy? An allergy is a hypersensitivity response to an otherwise benign substance. So something that doesn't normally hurt people can hurt this person. That's what an allergy is. Can't really explain allergies. We don't know why. They tend to run in families too. Genetics, is part of it. But yeah, so by exposing the person to the thing that's causing that hypersensitivity reaction, a little bit, then a little bit more, then a little bit more, then a little bit more, then a little bit more over time, they've had great success in these kids not being allergic. Right. I've been following this for about 3 years now at top. Pretty interesting stuff. The problem with some allergies that if they do have an extreme reaction, that can cause anaphylactic shock. And that's where the airway closes, right? So it's kids that have real severe allergies will carry an epinephrine or EpiPen with them. And if they get exposed to something, they can just boom, self-inject, or mom can inject them to actually stop that allergic or anaphylactic response. Food labels now. So even if you go out to eat, it will say on the menu, these foods may be exposed to peanuts or different types of nuts. So if you have an allergy, this is not the place for you, so they have to give you warnings. There are food intolerances. That's not the same as an allergy, right? So, and that's what you were talking about. Like you drank the milk, you got a stomach ache, that could be an intolerance. Usually that, if a person is truly lactose intolerant, they don't have specific enzymes to break down the lactose, right, when they take it in. Some people, it's just psychological aversion. Like, I don't like beets. I'm not allergic to beets. I don't have an insensitivity or anything to beets, but I don't like the way beets feel in my mouth. So I don't eat beets, so a psychological aversion can be almost as bad, because if somebody tried to force feed me beets, I don't know what I would do. Wouldn't be happy, that. So it could, because what kid do likes like shrimp, right? Little kids that like shrimp or oysters? No. But as adults, we refine our taste buds, and then because I love seafood now. I don't remember eating it when I was like 6 or 7 years old. But yeah, and it also depends on the family too, and what your culture dictates. I'm Italian. When I was little, I would eat tripe and I loved it. Anybody know what tripe is? It's cow stomach, right? Yeah. And yeah. And Italians do too. Yeah. I used to say Italians, we eat pagan deli, because it's some of the weirdest foods in the world we will eat. But anyway, so tripe, I loved it. My aunt used to make it, and my uncle, when I was about 7 or 8 years old, I remember him saying, "You know what you're eating?" And I said, "Yeah, tripe." And he says, "Cow stomach." I was like, "What?" So for a while I was like, "Can't eat that." And then once I got past it, when I was older, like in my teenage years, I was like, "Oh, who cares? It's delicious. I don't care." You're a Philistine if you don't like mac and cheese.
You could have been picked up probably by the shade, because I know, like for my kids, for example, we've been serving them the regular pot mac and cheese.
So the elbow macaronis, right? The little elbow macaronis, yeah.
So for whatever weird reason, maybe my husband decided, I don't know, he went to the store by himself.
Oh no, you can't let him do that.
And then he bought the mac that is wiggly.
Yes.
So
different shape macaroni.
So this morning we served the same everything. My daughter says, "I don't like this mac and cheese."
Yeah.
The other brother says, "I don't like this."
Yeah. So human beings are creatures of habit. That's the other thing too. So when people get accustomed to things, most people like a routine, and that comes to food too. I'm a weirdo. I get bored super easy. So I don't like the same thing twice ever. I can't take it, but most people like routine. And kids, if they've been eating the elbows and then you try to give them the swirly macaroni, what's that? I'm not eating that. It could be. It could. And some kids are more open-minded to trying new foods. Some kids are like, if you say, "Come on, just try one." No, I don't want it. So, we all have our own personalities, and a kid is just a grown-up that's not a grown-up yet, so they have that personality too. Some kids are just like, nope, I'm not having it. I don't want to try anything new. I like just what I've been eating, and let's just leave it at that. So It's personality. I think a lot of it's personality, family, genetics, those kinds of things, you know? Yeah, well, I mean, yeah, I didn't say it, she said it. All right, hyperactivity. I'm sure everybody's heard of ADD or ADHD, attention deficit hyperactivity disorder, right? It says here 11% of school-aged children have some type of hyperactivity disorder. Now, these are old statistics because this book is not a brand new book. I don't know what the numbers are today. I could certainly look them up, but that's a lot of children is what I'm saying. And the question that I always ask parents, can your child sit and play through a video game that they like? If the answer is yes, they do not have attention deficit disorder. You understand? Because that truly, they can't sit through anything, even something they like. They're going to be antsy and restless and, you know, want to get up and move. So, I think that sometimes we're quick to label and maybe should be a little more judicious before we throw labels on you're this and you're that, and, you know. Yeah, and that's just my own personal opinion, does not reflect the opinion of ACCC nor any of its affiliates. And there are lots of different treatments for hyperactivity disorder. People say, oh, it's the sugar, if you give them sugar. You know, not really. Sugar is bad for you. You know, excessive sugar is not good for you. It makes you fat. It can give you diabetes, etc. But it's not going to give you hyperactivity disorder. Okay, so just so that that's clear. Childhood obesity, 32% of US children are overweight, and 17% of that 32 are morbidly obese. That's a lot of children. Yes.
I know when I was a kid, felt like that role.
Baby fat. I was a fat kid. I was a chubby, I wasn't fat, but I was a chubby child. And I didn't start becoming unchubby until I was about 16. And then the weight just came off, you know? So some people truly have, you know, they call it baby fat. When you grow as a child, you don't grow evenly. So you'll get bigger and then taller, and then wider and then taller, and then wider and then taller. So for the times that you're just wider, you're wide, and you know, chubby. Right. So that people will usually grow out of. But when we talk about obesity, right, and true obesity, there's a difference, right? There's a difference. So when we're talking about more than 20% above the recommended body weight for your frame, that's a problem. And that's usually because of a sedentary lifestyle. They're not moving. They're in front of a screen. And it's also genetic. So parental obesity, if dad and mom are both heavy, you know, could be that, could be poor diet, right? Physical inactivity, or a combination of those three things, right? And these kids that are obese also have high cholesterol, high triglycerides, high blood pressure. They can have emotional issues because they may get picked on at school, you know? So there are lots of other things like, you know, collateral damage, if you will, for being obese when you're a kid. You know, there's a whole table here on slide 42 that goes through healthy eating habits for children. You know, make sure they're getting enough fruits and vegetables, make sure you're limiting sweets and soft drinks and fruit punches, high C, Kool-Aid. Make sure they're having breakfast every day. Doesn't have to be a huge breakfast, but they should be eating something in the morning before they go to school. Et cetera, et cetera. Here they're giving you some advice like avoid power struggles with your child. In other words, if the child is adamant and does not want to eat something, the parent, you know, you can get into like a little war, if you will. That's not a smart thing to do, right? And you don't want to get into a negotiation with a child either, because you're still the parent. So, you know, there's a way. You don't want it, you don't like it, okay, but you're not having dessert, right, if you didn't eat the vegetables. So that's it's okay to say no to things. The kid will not die if you say no. They talk about meal times at home. Children tend to eat better if they're hungry, and they get hungry by activity. So if they're out running around doing stuff, then they're coming, oh, I'm starving, right? So they're gonna be more likely to eat. Again, same thing, low calorie snacks as opposed to, giving them sugary snacks or chocolate or candy. This slide talks about school breakfasts, and yes, there are lots of federally funded programs now for low-income families, and they've changed the guidelines too, and the income limitations. They've gotten a little more lenient with them, so more children are now qualified to receive the free breakfasts and the free lunch, or the low-cost breakfast and low-cost lunches. Then adolescence. Boy, adolescence is fun. Everybody remember that, right? Lots of changes going on in the body. Another dramatic increase in growth, usually around puberty, right? There's just all these changes. 2.5 years, give or take. For girls, it says here it starts at 10 to 11, but there's something now called precocious puberty. Little girls are getting their periods at the age of 8, which is young. Used to be, 10, 11 was about the average age, 10, 11, 12 years old. Now it's slowly coming down to a younger age. Lots of schools have thought as to why we don't have a conclusive answer to that. But right around that age, say around 10 for girls, there's this growth spurt because of puberty and adolescence. And for boys, it's like 12, 13, something like that. And the brain is growing too at an exponential rate. And this is where body shapes start to change during adolescence. So it's a fact, whether we like it or not, males have more muscle mass than females. They do, they just do. That's just the body type of a male, right? Females, you can look at two skeletons and you could tell which one was a male and which one was a female based on the bone structure, right? Boys are usually about 8 inches taller. And by the way, people in general are taller now than they were back in the day. Yeah. So as we progress and as we evolve, people have been getting taller. So if you go into an older home, so, like a home that was built, say, in the early 1900s or the 1910s or 1920s, you'll find the doorways are smaller, right? Hallways are small, rooms are smaller, closets are smaller. People were smaller. Fact, right? People were smaller, they were shorter. We're getting taller as we evolve, so. Energy and nutrient needs for teenagers. If depending on how active the kid is, they could need as much as 3,500 calories a day. And that's a lot of calories, right? But if they're inactive, they only need somewhere around maybe 1,800, which is still a lot of calories as for an adult. But remember that growth that's going on inside their body, they need those calories to compensate for that growth. And they have all these vitamin D, they got to get sunshine, they need iron, they need calcium, especially during those adolescent years because of bone development. Make sure they get enough calcium and vitamin D. Make sure that if they are eating snacks and kids want to snack, and they should snack because, small frequent meals is the best way to eat, but make sure that the snacks are healthier, not, like I said, not crap. Kids should not be drinking soft drinks at all. The consumption of soda is linked directly to childhood obesity. Believe it or not, you go get like a meal at McDonald's or Burger King, and I'm not targeting McDonald's or Burger King, all fast food places. And the sodas, it's a lot of soda, a lot of soda, not good. And also they shouldn't have caffeine. So really a little kid should not be drinking, Coke or Pepsi or Mountain Dew, anything with caffeine in it. Shouldn't be having Red Bull. Don't give your kids Red Bull. And I talked about this already. So kids that are obese when they're children are at risk for all these other diseases. Type 2 diabetes. They're also at risk for peripheral arterial disease, coronary artery disease, hypercholesterolemia, hypertriglyceridemia. I mean, the list goes on and on. So you've got 12-year-olds with the same kinds of conditions as a 72-year-old, which, shouldn't be. And don't let them start smoking. It's a very bad habit. It says here that genetics does not play a determining role in obesity. It says the individual is not destined from birth to develop obesity, hypertension, and type 2 diabetes. So I will say to you that you can fight your destiny, right? But there is tons of research out there that proves these things run in families. Not a guarantee that you'll get them, right? Because if you eat right and lead a healthy lifestyle, you may never suffer from any of them, right? But certainly you can have a predisposition. So I would disagree with that. We're almost done. Type 2 diabetes, I talked about that already because they're eating so many carbs, the bad carbs, the sugars, that number one, the pancreas can't produce enough insulin. And number two, the cells become resistant to the insulin that they are making. And so that's how kids are developing type 2 diabetes. Atherosclerosis, that's high cholesterol. Little kids can have strokes. Can you imagine a 12-year-old having a stroke because of atherosclerotic plaque in their arteries because of so much triglyceride and cholesterol? So yeah, coronary artery disease. It's sad. High blood cholesterol, right? And when you move around and exercise and break a sweat, your body will produce more of the HDL, which is the good cholesterol, right? And it helps to eat away at the bad cholesterol, the LDL. So the same holds true for kids. That's why they should be moving around, you know, running and playing and that kind of thing. And then childhood hypertension. 90% of people who smoke started smoking before the age of 18. So 90%, but there is that 10%. And, you know, that is true. You know, some people start smoking older, later in life. So, and that's it for this chapter. So let me stop my share and let me stop my recording.